Now for the next category of drug or examples of drugs that I'll be talking about, these are the antipsychotic drugs. So just a category, we look at the various classification of drugs that fall under this category and the various examples of drugs that fall under each of the categories, of course. So antipsychotic drugs, of course, used in treating all the psychosis issues, okay, of the brain. So for antipsychotics, we said that they are also known as what? Neuroleptics. So they are used in treating all those, schizophrenia, bipolar disorders, psychotic depression, and acute psychosis. Do you understand? So they are classified into different types. We have the first generation, which are known as the typical types. We have the atypical types, which are also known as the second generation. So these ones are quite simple, first generation, second generation. I think that's all. So for the typical ones known as the first generation, we have drugs like the Haloperidol, we have drugs like the Fluphenazine, we have drugs like the Fluphenazine, we have drugs like the Trifluoperazine. Okay, so they block dopamine D2 receptors. So they will reduce what? The dopamine D2 receptor being stimulated. So to reduce episodes of hallucination and delusions, just thinking about what doesn't exist, So they are used in treating all those schizophrenia, acute mania, and severe agitation. Haloperidol. So adverse effects, they can cause extrapyramidal symptoms like dystonia, Parkinsonism, tardive dyskinesia, hyperprolactinemia. Of course, their adverse effect was the reason why the second generation drugs were brought up. They can cause sleepiness, they can cause hypotension. Okay. So, okay. I didn't actually bring a picture of this. Okay, this is haloperidol, right? So let's look at the next generation. Next generation is what is known as the atypical ones. These ones are the second generation antipsychotics. What are the examples of drugs that fall under this category? We have drugs like the clozapine. This is clozapine. We have drugs like the risperidone. This is risperidone. We have the olanzapine. We have the quetiapine. We have the aripiprazole. We have the ziprasidone. So those ones, they block both the dopamine D2 receptors and also what 5-HT2A receptors. So they improve both positive and negative symptoms. Okay, so that is in treating schizophrenia, bipolar disorders, and also depression. So they can cause metabolic syndromes like weight loss, diabetes. Okay, so but you can see that their side effects is not as crazy as these guys. Okay, so that's for this atypical generation and typical generation of antipsychotic drugs.